Welcome to our medication lecture. The objectives of this lecture are to give the definition of medication, to state the principles of giving medication, to cite the different components of medication order, discuss the assessment of medication, mention the different routes of medication administration, and to discuss the standard timings of medication. To give you the definition of medication, it is the substance administered to cure and to treat a particular diagnosis or to relieve symptoms and for prevention of disease. Medication is a legal drug administered for its therapeutic effects. The prescribed medications must convey an order by the name of the client or patient, the name of the medication, the dosage, the frequency, the route of administration, physician's signature, and the time when the doctor ordered the medication. There are rights and principles of administration of medication, which are the right medication, the right dose, the right route, right time, right client or patient, right documentation, right approach or smile. Patients are also having rights in receiving the medications. That the patient has the right to expect safe and appropriate drug administration, right to refuse the medication, and the patient has the right to take medication information. There are hospitals' policy in medication administration, which are 2 registered nurses must administer the medication, and that is to prevent drug errors and to confirm that correct medication has given to the correct patient in correct dose at correct time. There are several types of medication order. They are standing order. These are the medications ordered that should have been carried for a specific number of days until order is discontinued or changed with another medication. A concrete example of this is amoxicillin 500 mg to be given 3 times a day for 5 days. PRN order. This is an ordered dose which do not indicate a specific time for administration, only when needed. Example of these are pain medication, medication for nausea, and laxative. A concrete example is metoclopramide 20 mg intramuscularly every 6 hours for vomiting. Another type of medication order is one-time order. It is a single order has written for medication that will be given once a day or once. An example of this medication are medication for immunization or immunoglobulin, like to give ATS 0.5 ml intramuscularly after a negative or anti-negative skin testing. A stat order or immediately. It is an order for medication that is to be given immediately, and those medications are life-saving drugs or to have immediate effect. Example of this medication is nifedipine 5 mg sublingual now. Medication assessment. It is very important that the nurse should know the medication history of the patient, the allergies and intolerance of the patient to the certain medication prescribed, the medical history of the patient, and if the patient is pregnant or lactating. There are different types of medications, which are oral medication. And under this oral medication, it is given through oral, which is being swallowed by the patient, sublingual route, which is dissolved under the tongue, buccal route, which is held inside the mouth of the patient until they are dissolved. And also, oral medication can be administered through the nasogastric tubes. Parenteral medications are given through injections and infusions. And under this type of medication are intradermal, which is allergy testing or tuberculin skin testing, usually administered under the skin that is in the forearm, in the upper arm, or across the scapula. Subcutaneous medication is injected in the subcutaneous tissue layer of fat below the dermis. Intramuscular is injected into the muscle layer beneath the dermis, and intravenous medication is injected directly into the vein or through various access devices that placed in the vein after vein puncture. Another type of medication is inhaled medication, which is induced or to induce anesthesia and to treat respiratory disorders. Suppository medication, this is inserted into the rectum or vagina. Topical medication is placed on the skin surface, mucous membrane, or body cavities. An example of these medications are lotion, cream, and ointments. There are also medications under the classification of drops and ointments, and these are ophthalmic medications. These are solutions or ointments used to treat eye infections and glaucoma and eye irrigation. Ear medications, these are solutions dropped into the ear to treat external ear infection or to soften and remove earwax. Nasal medications are solutions sprayed into the nose to treat nasal congestion. Intraspinal medications are drugs injected into the spinal cord, and an example of this are anesthetic drugs. And intracardiac medications are those medications injected directly into the cardiac muscles, which is used to stimulate the cardiac muscle as a life-saving medication. In administering medication safely, there are several tips or guidelines that we have to follow. These are medications must have physician's order or prescription before it can be legally administered to a client. If the written order is illegible or is questionable for any reason, the physician must be notified for clarification. Clarify with pharmacist if unclear or questionable orders. Verbal orders should not be carried out. The nurse who prepares the medication must also give it to the client and document it. Document the medication, time, dosage, and route in the client's record. If the client is allergic to the medication, an allergic reaction may occur. It is an immediate life-threatening reaction, which means that the client is hypersensitive to the drug. If the medicine is refused by the client, record it and report it to the physician and note on the chart. There are standard timings of medication administration. These are the frequency and the particular time when it should be given. Like once a day, it should be given at 6 a.m. or in other hospital, it is given at 10 a.m. 2 times a day is given at 600 hours or 6 a.m. and 1800 hours or 6 p.m. or it is every 12 hours, which is given at 1000 hours, which is 10 a.m. and 2000 hours, which is 10 p.m. 3 times a day is given at 600 hours or 6 a.m., 1400 hours or 2 p.m., 2000 hours or 10 p.m. or it is also called every 8 hours medication. 4 times a day is given at 600 hours, which is 6 a.m., 12 noon, which is 1200 hours, 1800 hours or 6 p.m., and 2400 hours or 12 midnight, or it is also called every 6 hours medication. There are also abbreviations that are being used or universally used in administration of medications. These are G, which signifies or means gram, mg, which is milligram, mcg, which is microgram, L or liter, ml or milliliter, mec or MEQ means meal equivalent and kg as kilogram. AC means before meal, PC means after meal, PO means per oral, NPO means nothing per oral, DC means discontinue, ad lib as desired, GTTS as drops, U means unit, pre-op means before the operation, and post-op means after operation, tab for tablet, INJ for injection. Also, abbreviations are being used for the frequency of medication, such as OD means once a day or daily, BD or BID means twice or 2 times a day, TID or TDS means 3 times a day or thrice daily, HS means at bedtime or at hour of sleep, QID means 4 times a day, Q1H means every hour, Q2H means every 2 hours, Q3H means every 3 hours, Q6H means every 6 hours, Q8H means every 8 hours, Q12H means every 12 hours, PRN means as necessary or as needed, STAT means at once or immediately, and NOC means at night. Also, it is used in the route of administration. ID means intradermal, IM means intramuscular, SC means subcutaneous, IV means intravenous, PO per oral or by mouth, SL means sublingual or under the tongue, PV means per vagina, and PR means per rectum. And the calculation or computation of medication lecture will be given in the next video.